Wash hands before preparing medications. Check for allergies on the medication administration record.
I am preparing medications for Mr. Paul James, and it is noted that he's allergic to shellfish.
Perform 5 rights of medication administration, checking each medication against the medication administration record.
So Mr. Paul James is due to receive his metoprolol tartrate, 50 milligrams PO today. I'm holding it. If his systolic blood pressure is less than 90 millimeters of mercury, it is due at 8 a.m. He is also due to receive Synthroid 0.1 milligrams PO today at 8 a.m. And this is Synthroid 100 micrograms, which is equivalent. Heparin injection, 5,000 units sub-Q this morning at 8 a.m. Heparin sodium injection, 5,000 units per ml.
Identify medications requiring calculation to achieve correct dose. Perform calculations correctly. Identify medications requiring assessment prior to administration and place medication in a separate medicine cup. Prepare injectable medications correctly. Liquid medication is poured at eye level.
So Mr. Paul James reported that he was constipated, so he will be getting milk of magnesia, 30 mLs by mouth as needed for constipation.
Prepare a tray with medications and alcohol pads. Perform 5 rights of medication administration, checking each medication against the MAR.
First medication for Mr. Paul James is metoprolol tartrate, 50 milligrams PO daily. I'm holding if his systolic blood pressure is less than 90 millimeters of mercury. It is due at 8 a.m. and it is in its own separate cup. Mr. Paul James is also due for Synthroid 0.1 milligrams at 8 a.m. I have Synthroid 100 micrograms. Mr. Paul James is due for heparin injection, 5,000 units sub-Q, 8 o'clock this morning. Heparin sodium injection, 5,000 units per ml. And he is also receiving a PRN medication, milk of magnesia, 30 mLs by mouth for constipation.
Identify resources to access for information regarding medications.
I have a drug handbook in my med cart, and I also have an electronic version on my computer. I am now leaving my med room and heading to the patient's room. Good morning, Mr. Paul James. How are you? My name is Rosa. I'm going to be your nurse today, and I have your morning medications. How are you this morning? I'm just going to draw the curtain for privacy.
Introduce self, role, and purpose of the interaction to the patient. Maintain privacy. Ask patient if any concerns about the medications.
Mr. James, today I have your metoprolol, so I'm going to take your blood pressure before I give you that, and if it's not too low, then I would go ahead and give you that medication. I also have your Synthroid and a heparin injection for you, and in addition to that, you're going to be getting milk of magnesia to help you with your bowels. Do you have any questions about your medications? No.
Perform 5 rites of medication administration, checking each medication against the MAR while in the patient's room.
Milligrams peeled daily at 8 o'clock. I'm holding if his blood pressure is less than 90 millimeters of mercury. Mr. Paul James, I have Synthroid 0.1 milligrams PO at 8 o'clock. I have Synthroid 100 micrograms. For Mr. Paul James, heparin injection 5,000 units sub-Q at 8 a.m. Heparin sodium injection 5,000 units per ml. And I have milk of magnesia 30 mLs by mouth as needed for constipation.
Identify patient using 2 identifiers by checking the arm band against the MAR.
All right, Mr. James Paul, can I just have you tell me your first, last name, and your date of birth, please, while I check your name bracelet? Okay, good.
Wash hands. Provide fresh water for the patient.
Mr. James, I have water here for you. Can I have you hold your water?
Ensure patient is positioned properly for medication administration.
Just going to stitch you up a little bit more. Is that okay?
Perform assessments for medication administration as indicated.
All right. You can take this back for a minute here. Just put this blood pressure cuff on your arm if that's okay. I'm going to listen to your blood pressure. Okay, good. Your blood pressure is 100 over 78 this morning. So I will give you your metoprolol. Let me give you your water back. There you go. Hold on to that. Now these 2 pills, your metoprolol and Synthroid, they're pretty small. So do you want me to give them to you at the same time? Okay. I'll put the cup right up to your mouth. I'll pop them both in. Okay. Go ahead and drink some water and swallow those for me. Good. Did those go down okay? Can I take a quick peek? Good.
Client is observed to ensure medication is swallowed. Identify site for injection appropriately.
All right. Are you done with the water? I can take that back. Okay. Thank you. All right. I have to give you your, oh, actually, we forgot your milk of mag, so let's give you your milk of magnesia here. All right. Good. And here's some water so that you can wash that down. That definitely needs it. Okay, perfect. All right, so now I have to give you your injection. It's going to be in your belly. So if I could just take a peek at your belly. I'm only going to expose your belly area. All right. Okay, so we're going to go right about there.
Donned gloves for injection.
clean off your belly there, so you're gonna feel a little cold. I'm getting ahead of myself.
No, you're good. Administer the correct dose for injected medication. Administer injection correctly.
Alright. Mr. James. Alright. Click pin for pay. 1, 2, 3. Okay. Not too bad, right?
Document appropriately on the medication record and clean medication tray after medication is administered.
So let me just sign off that I gave you your medications. Just gonna wipe